Welcome to the Leaders in Housing Counseling call for March 26th. This is our experiment in a pre-recorded call. Normally we do this in a live audience, but we had a meltdown last week because the audience was so large and because GoToWebinar didn't have the capacity. We're hearing that they've built the capacity up, so we'll go back to the normal format next week. But for this week, we have our panel together, and you'll be able to listen to it at your own convenience. So let us know how you think of this, how it works. The downside is that we don't get people to be able to submit questions while it's going on. But on the other hand, get a good signal, and hopefully this is nice and clear and works for everybody. So let's dive right in. The theme for this meeting is really what are the technologies and needs you have in the field to make your work well in a now virtual world. How are we doing these transitions and what are we learning about it? So we have experts in the field who are in the middle of it, who can give you what their experience is, what they've learned, pluses and minuses. We're really hoping this will be a practical session that will be able to help everybody in their work. So we'll do a quick legislative update. There's a lot happening at the time you actually hear this. We may know more, and we'll certainly give you an update on the next call that will be relevant. But we'll do our best to bring you up to date right now. And we'll spend most of the call on the what people are doing out in the field to deal with the coronavirus, the COVID-19 work, and how they are able to manage in a world where they're not going to their office, mostly, I guess, not going to their office, and being able to do it virtually. So, and then we'll do a quick plug on membership dues, and then we'll talk a little bit about our next call, April 2nd. We're going to have Fannie Mae and Freddie Mac and FHA to talk about forbearance, foreclosure, and loss mitigation, and what's new and changed and what you need to know. We'll also have the National Consumer Law Center, Steve Sharp, who's a practicing attorney who's very good about understanding the ins and outs of this. So we will be able to hopefully fill you in on the pieces that you need to know. One quick note is that we're going to start that session at 1:15 on the idea that that's starting on the hour, and it's not quite as crowded when you go in, and that might also give us a better signal. Okay, with that note, let's pivot in. And Melody, I know a lot's going on. Can you fill us in on what's happening in Congress?
Sure. I hope everyone can hear me okay. I'll try my best. For those who will be listening to this, things are happening on Capitol Hill so quickly that it's really difficult for advocates to sort of follow everything that's going on. I'll try my best to sort of summarize what's been going on. So obviously coronavirus has severely impacted the economy as well as national and local markets. As a result, states and cities as well as the federal government have issued several economic shutdowns to ensure that people stay at home to prevent further spread of the coronavirus. Given that, we sort of started to face a new economic issue of those who have been laid off because their industries have been impacted by the virus. And now we have a lot of housing challenges in sort of this new normal, at least for the short term. Congress has been working day and night for the last several days on various stimulus packages. The first one being more so around immediate emergency assistance to states and local governments to address the public health issues that they're facing. And the current one that is being debated this week that just passed the Senate and is now going to be debated in the House today for hopefully passage tomorrow as we go to the president's desk is essentially one to sort of address multitudes of things, but in particular for our interest, housing. So we worked really closely with everyone that we could, the House Financial Services, appropriators in both chambers, Senate banking as well, to see if we can include funding for housing counseling in this stimulus package as well as any further stimulus package. What we hope that emergency funds for housing counseling will include is that the funding can be spent directly on delivering the full services of HUD housing counseling activities, as well as to be spent on equipment and technology so that they'll be able to deliver these services virtually. So a lot of people are doing work from home, and as you're trying to reach these consumers, a lot of the smaller agencies are facing this new challenge of, okay, we can try mobile counseling, but we just don't have the capacity yet. So we want to ensure that funding will cover that need, as well as the funds being spent on training to include rental and foreclosure, both which are very, very critical at this time. Several states and some cities, like here in Philadelphia, have issued temporary moratoriums on evictions and foreclosures, but we imagine that once those lift, we'll still be facing those problems. And for those who are facing that issue, whose cities or states have not issued that moratorium, they're quite concerned. So we're working really closely with Congress, and we're hoping that they'll include those measures. NHRC and the Coalition of HUD Intermediaries sent a joint letter making this full request to all members of the House and Senate, asking for $150 million towards this end. We're hopeful that they'll consider this, but at least in the current stimulus package, it's very close to completion. But for future stimulus packages, we hope they'll include it. Just to give a quick run through on any sort of housing counseling related information in the current stimulus. So while there is not specific legislative language on housing counseling in the current stimulus package, the CARES Act, there is a provision in the legislation around emergency solution grants, which is $4 billion to address the impact of the coronavirus among individuals and families who are at risk of homelessness, and additional homeless assistance. The Senate Appropriations summary of each provision says that eviction prevention activities will include rapid rehousing, housing counseling, and rental deposit assistance. But this is just one summary. There may be additional talks. Language may change between when this summary came out and when it actually gets passed in the House. So NHRC will be following that very closely. In the event that the current language in the text does pass, there will likely be a committee report, and then we'll be able to see for certain whether or not the emergency solution grant goes towards housing counseling or not. But right now, we are not guaranteeing that. Overall, we'll update members and partners on all federal and absolutely state and local actions pertaining to coronavirus and housing counseling as it comes in. Again, so much is happening so fast that we're trying to keep up. We're working really closely with our federal partners, our state and local partners, to get information as fast as possible and reach our membership. But for those who hear this recording, if you hear anything in your state or municipality around housing counseling, whether it be local ordinances on how they're addressing foreclosure or eviction, if you hear anything specifically on mortgages, please send that information to me. You can see my email there, and we will try our best to either, inform legislators or get the word out nationally on what's going on the ground and how critical it is for housing counseling agencies to be protected in this situation as we go forward, as well as housing counselors being part of the conversation on helping communities once we get out of this crisis. And I'll turn it back over.
Thank you. And what do you do right now? Well, it would be very helpful to reach out to House and Senate members about getting a housing counseling funding in place. You can use the letter, the joint letter which we circulated, or you could just write your note, make a plug for $150 million, and just say what's going on in your local community. There are some initiatives that clearly include housing counseling in this, especially in the House. And so this is right now, our job is to figure out how to get into that second bill that is coming out of the House. So doing that would be very helpful. One other just nuance that some of you are, I'm sure, aware of is that under current HUD contracts, we can't bill for equipment and for technology, and that's a shortcoming review. And what we were trying to do is get language not only for money in the bill, but also for getting technology and equipment as direct cost, so that Congress is directing HUD to start allowing us to bill for these things and to use the increased money for some of that for that. Obviously, plenty of it will go for direct services, plenty of it will go for training, but we really need to get money out to the local groups for doing these upgrades and being able to get them to be very virtual programs. So much more on that to come, but the best thing that could be done right now is to reach out to your House and Senate members. And I know you might have done it last week. It's not a problem to do it again today, because it really is that you got to keep making the case, keep reminding them about what you're doing in the field. Okay, thank you, everybody. Let's quickly now move forward to the broader agenda, and let me turn it over to Ellie Pepper.
Thanks, Bruce. Hi, everybody. So as this crisis has evolved, many organizations are working from home or having very limited hours in the office. So we put a panel together to try to discuss different ways that you can successfully provide services, meeting all requirements, and still meet the needs of your clients. So our first speaker is Teresa Bardwell with RCAC, and she's going to spend a little bit of time telling us about what's important to be thinking about and planning for now and for later. Teresa.
Great, thank you, Ellie. Well, as it was said earlier, the landscape is changing daily, so I'll do my best to kind of base it on what we know today and hopefully down the road. I wanted to speak about two things. The first thing is the training, because we do have quite a few training partners on the call as well. And just, you've probably seen a change there that the classes pretty much, I think, have been postponed or canceled from April. We will probably be looking at more postponements as we get further down the road, depending on what path the virus takes. So, as we know more, we will be doing more as training partners. And certainly the certification date remains. A lot of the testing sites have been closed down. So for those of you who are not certified, we recommend taking a look at the web classes that are being offered and, starting to get what you need to get set up to do the test online. As the colleges have closed, those were many of our testing sites. So as you're thinking now and ahead, start studying up for your test. If there were to be an extension later on, you can always take a live class later, but we want to make sure everybody's ready and has their certification by August 1st. And we haven't had a lot of guidelines from HUD other than they are doing an extension. So we do know the training grant will not end in September, it will go through December. So that gives us a little more time to bring live classes back on. So I do want to go ahead then and take a look at the counseling piece, which is probably bigger for most of you. As Ellie said, many of you are now working remotely. I'm in Colorado, and they just put the stay-at-home statewide effective 6 o'clock this morning. So unless you're essential, you're supposed to be staying at home and protecting everybody. As we've looked at New York and Washington and California, the numbers are going up rather rapidly, so I'm happy to do my part to stay home. And I'll use RCAC as an example. We're fortunate. We have about 2/3 of our folks that are already in home offices, so we didn't have quite as large a issue to change over. But we only had about 3 days because our corporate offices are in California, and we had to get everybody remote. So all of our staff now are remote. We do have a couple people going in on a regular basis just because we have mail and some things that have to be done. But, you know, so as we look at working remotely, equipment, something that had an immediate need. And so as you're working from home, you know, laptops are typically the way to go because those are a lot of times cheaper and you can use them later. So laptops, you need to have some kind of software. It'll usually come loaded with Microsoft 10. If you have an older computer, I happen to have a personal computer that was on Microsoft 7, and I was able to upgrade that for $25 just going online. So that's something to keep in mind. Maybe you can upgrade some older equipment as well. But you need to think about having at least a laptop. I highly recommend getting a headset because if you're going to be doing any kind of counseling, as you've noticed, anytime you've been on webinars, because everybody's at home, you'll hear kids and dogs and things in the background. So headset really helps get rid of some of that. You'll also need to take a look at, you know, your keyboard and your mouse if you can get those. Perhaps a one-and-all printer in case you need to scan. Scanning documents is something that will probably be critical to get it into your electronic system. So that's something that all-in-ones I saw out there from, I did a little bit of searching today for $60 to $90. Best Buy, Costco, Sam's Club all still have equipment available, at least in the Denver area. And so you can have those delivered, you can pick those up, they'll do curbside for you now. So you can get that equipment that you need. And I do know in rural areas, it's a little bit more difficult, so you may need to look at delivery. You also want to think about, and as Bruce said, unfortunately, due to the way the NOFA was written in 2018 and on, we are not allowed to charge equipment. So you'll have to find a different source unless we can get some technology funding. I did check with HUD, and they said if it's software that you have to do the counseling, you can cover software under your grant. So my recommendation there is check with your point of contact and make sure that it's okay with them, but some of the software would be allowable. So if you need Microsoft Office, that can run 60 to 130 depending on which one you're buying, that might be able to be covered. Certainly your CMS system. And so you can check with HUD and see which of them they will cover. You also want to think about protection, and I know some of our other speakers are going to go into more detail later, but be sure that you're thinking about, as you're sending information back and forth, that it is protected so that you're sending it with the protection that you need. One of the things you may want to think about for your home system is a virtual private network, or VPN. I did a little checking on that. There are some free VPNs out there, and what that does is instead of going to a public server, you go to a private server, and it gives you better protection. I know at RCAC, we have a VPN set up for our main server at our corporate offices. So if I want to get to any of our corporate files there, then I have to go into that VPN to access those. And so you may have that going on with your company as well. You can get free VPNs, but you typically get what you pay for. So if you look into them, you need to see about how much data you're allowed to do and the speed with which. Anytime you use a VPN, it typically will cut down on your speed. And so I have high-speed internet because I do trainings from home. But particularly if you're in a rural area, that might be problematic. So you would only use it at the times that you really needed to. But you know, the free ones are usually a lot slower. I happen to have Xfinity, which is the high-speed carrier in the Denver metro area. And for $35 a year, I can cover 5 devices with a VPN. So you may want to check into that. Another one that I have a tech friend that speaks very highly of this one, and I've used it at his house, is called NordVPN. It's N as in Nancy, O-R-D as in dog, VPN. And that one you can get for, if you want to do just a 1-year program, it's $6.99 a month. You can do just 1 month at $11.99. And if you want to go out 3 years, you could do, it's $3.49. So, you know, it's still pretty cheap to get a good VPN, and the NordVPN is recommended by a lot of the computer magazines and is very effective the way it works. The other thing is keep in mind your speed on your internet. Don't use free hotspots. Those are just asking for trouble. Anytime you get into the free ones, like hotels, Starbucks, coffee shops, any of those, if you have any in your area, be very careful because those are highly attackable, and we see a lot of cyber crimes coming out of those. So avoid those. If you have a phone, you may be able to use your hotspot on your phone. I was watching the news this morning, and a lot of their reporters are reporting from home. And one of the reporters was on the regular internet system, and they couldn't get her. She just kept freezing. So she went on her hotspot, came back in, and the report went beautifully. So if you're having trouble, you may need to trade back and forth. Just something to keep in mind. And then, so as we're looking at getting into the shorter term, we need to get set up remotely. If you're looking at changing to doing more and more phone or internet counseling, great. HUD has come out and said if you're doing it on a temporary basis, you don't need to change your work plans. We know hopefully this will be a short term. Should you decide on a long-term basis that this is something you're going to continue to do in your program, then at that point you will need to change your work plan and get it to HUD. So they saved us a little bit of work there. Then we need to also be thinking longer term. So we're short term, we're going to be in our home offices, doing the best we can to set up a private area because many of you have spouses or partners or children and animals that are sharing your space with you. So try and find a quiet place that you can work from. I know this reporter I mentioned has redone a closet in the basement as her office that she'll report from because it's the only place she could find that it was quiet. Somebody still has their mic off, and I hear a lot of paper shuffling. If you could go on mute, that would be helpful. And so as we look longer term, we need to think about what's going to be coming at us down the road. And I think as we look at the reporting that's coming in now, we're starting to see appointments being canceled. Certainly I think first-time home buyers probably have, unless they're in a situation where they need to, a lot of the home buying, I think, will start to slow down. With that, we may see some decrease in prices, which hopefully down the road will help bring that back. But if you've lost your job or you're in fear of losing your job or you're forced to take vacation time, these things are going to impact us further down the road. So we have counselors that may be out of work and looking for some of the stimulus packages that are being out there, but many of our clients are. And I think was mentioned earlier that we're going to start seeing more people saying, what do I do? I've got this, waiver of making my payments for 90 days, but what do I do when that 90 days is up? I still owe the money. So we're going to have to get educated on the products that are coming out for the short term and be in discussions on how that's going to look in the long term. So you should probably be staffing up and looking at foreclosure as we go down the road. Unfortunately, it looks like we may be seeing foreclosure, in 6 to 12 months. So something to think about and start preparing yourself for. And then another thing I wanted to mention is just keep your eyes open for lessons learned. I know Christy's going to go into kind of disaster recovery, your emergency preparedness, and your continuation plans, your COOP plans. But I wanted to mention one that just the things you don't think about until they happen. And, RCAC has about 60 people at our corporate office. And the one thing that nobody thought of is in the planning process and was, what do you do about the mail? The mail is still going to come in, and there's still going to be checks that need to be deposited and mail that needs to be forwarded to somebody. Somebody needs to scan it and forward it. So for us, that was one of those small things that nobody really thought about until it happened. So be sure that you're taking notes on lessons learned and adding those to your emergency preparedness as you go down the road. And, I would have to say I've read a lot of emergency preparedness and COOP plans, and certainly for our sub-grantees because we are an intermediary. And I don't think anybody addressed the pandemic in their plans. So, as we go down the road, let's take notes, learn some lessons, and hopefully it'll help us better prepare for this down the road. Hopefully we won't see anything like this again, but I think now that we know, we have to prepare for it. So thank you all. I appreciate your time, and I'm going to turn it over to our next panelist.
Thank you so much, Teresa. So we are now going to hear from, I'm sorry, I'm trying to, here we go. We're going to hear from Bailey Childress, who is with NeighborWorks America. And Bailey's going to talk with us a little bit about the best practices for supporting housing counselors and other staff during this crisis. Bailey.
Thanks, Ellie. And like Teresa mentioned with our CAC, NeighborWorks has a number of staff who already work remotely. So it was a little easier for us to move fully remote during this crazy time than it has been for some others. So I definitely feel fortunate for that. But I'm happy to be on the call today and to share some valuable insights and best practices that we've heard from our network organizations over the past week or so. Several organizations have come to us and shared some information around addressing the challenges related to remote working. Last Thursday, we actually had a call with 3 of our NWOs, one of who primarily discussed their plan for managing remote staff and have also adapted quickly in both their service delivery and their ability to move workers remote. So many of the topic areas that we also discussed on that call last week will be covered in today's presentation. I think it can be a little bit easier to forget about the internal operations and just the management of staff than it is to kind of put service delivery and business continuity at the forefront. But this is an extremely stressful and unprecedented time in our history. And so it's important that the physical and mental health of your employees is at the forefront of your minds, especially if you are in a leadership role, you're a manager or an executive director. Now's a great time to step back and take a look and evaluate your management practices and the policies that you have in place that might involve your leave policies or your teleworking policies, or to develop one if you don't have one in place for teleworking. You'll need to be flexible and amenable to the needs of your individual staff members, and individual staff members is key there. It's not going to cut it to apply the same management style to each employee that you have. Everybody has a different situation. Some may be sick themselves, some may be taking care of loved ones, some live by themselves, some have children, and that can pose additional challenges just depending on your circumstances. Staff are challenged with the same challenges that the customers and clients are, that your agencies are serving. So I think that that's important to keep in mind that this could be a financially stressful time for counselors and other staff at your organization as well. And so one tip that I thought was really neat was an organization that was presenting on the call last week had shared kind of a resource guide with their staff members and set up a practice of just sharing news stories, articles, fun activities to do with children, ways to keep yourself busy that weren't necessarily directly related to work, which is also an important aspect of this process and managing that staff. You want to make sure that you're giving space for staff to share their own experiences and how they're experiencing this time, and to vent if they have anything they need to vent about, before just jumping into work conversations. When you do have meetings with your staff, you want them to be frequent, especially when you're working remote. Most of the agencies said that they're meeting with their teams as managers at least weekly, and then doing one-on-one check-ins with individual staff members at least bi-weekly, sometimes more for some folks depending on the needs of a specific counselor. When you have those initial meetings, you want to make sure that you're setting clear goals and defining the role and responsibility of that individual staff person, and also setting expectations for what's expected while people are at home, what's allowed, where can you be flexible, where might things need to be a little stricter, where is the accountability, and how do you keep people accountable, making sure that those expectations are made clear. It's also important to get feedback from your staff on the technology or the method you're employing to deliver services. They're on the front lines and engaging with the customers in likely a new setting and a new way. And so hearing what they have to say and taking their feedback can be really valuable in kind of learning from your business practices and what you might be able to do or change going forward. So to summarize, you really want to make sure that you're creating an environment that promotes trust and compassion, sharing with folks that, you know, it might be a stressful time, but you can rally together and find stability in that and hope. This isn't going to last forever, hopefully, knock on wood, but that it will end. And I think, you know, as Teresa mentioned at the end of her presentation, there's definitely lessons to be learned here. So you want to give staff also the space to share lessons learned and figure out opportunities for your staff and your organization to grow and to highlight some of the challenges and the opportunities. And some questions you can ask yourself to kind of step back and do a personal check as a manager or a leader would be to ask if you have a clear plan of management, if there's a clear chain of command, if there's a clear process flow for information and communication, which during this time you always want to err on the side of over communication. Do people feel well informed? Do they feel that they're prepared to do their job and to do it well? And how are you showing your employees that you care about their well-being? And those are just a couple of questions that some of the executive directors and managers at our network organizations have been asking themselves and their staff to do those check-ins and make sure that everybody's on the same page and can continue doing the work that needs to be done. So thank you all so much for your time today. I really appreciate you having me, and I will turn it back over to Ellie.
Thanks so much, Bailey. So now we are going to move to David Young with Housing Action Illinois, and he's going to talk with us about a website that they are putting together about what housing counseling agencies can and should be doing during this time. And then also, David's been doing some research about online virtual platforms, and he's going to tell us about that. David.
Good afternoon, Ellie, and good afternoon to everyone else. It's good to be here. Yes, I want to start by indicating that Housing Action Illinois, has put together a web page of resources for housing professionals, and that can be found on our website, which is housingactionil.org. Again, housingactionil.org. And we are updating that information quite regularly. So everything that we're finding out, both on a federal, state, and local basis, we are adding that information. Anything that we're finding out from financial professionals regarding mortgage relief, we're adding to that resource page as well. Anything that you hear that you think we should know, please let us know, so that we can make sure that that information is added. Now, as our other speakers have talked about, that we are experiencing something very different. And so it means for a lot of the housing counseling community that we are making a transition to doing virtual counseling, both one-on-one as well as group counseling. We are not sure how long this is going to last, but for the foreseeable future, we do need to make some changes in how we deliver these crucial services. So, with a intermediary network of 33 subgrantees, we knew that it was important to look at what types of systems were out there so that we could provide guidance to our subgrantees about what systems they can use in order to conduct these virtual counseling sessions. And so I know that some of the things that I'm going to say, many organizations have heard, especially larger organizations that have their own tech departments have probably done some of this research and made decisions. But I'm really hoping that my comments today will help out some of the smaller groups that don't necessarily have a tech person or a tech team to provide some guidance. And I will also say that I am not a techie myself, so I would suggest that before your organization signs up with a system, that you hopefully there is someone who takes care of technology with your organization that you'll be able to talk to work with, to make sure that that solution is going to work well for your organization. But the goal today is just to provide some practical solutions for video conferencing that you can use. And the systems that I'm going to talk about today all use sophisticated encryption to make sure that the sessions are protected. And some of these systems are also HIPAA, or Health Insurance Portability and Accountability Act compliant. But again, in order to make sure you're doing the right things, you want to work with your tech person to make sure that all of those things are in place. And to piggyback on what Teresa said earlier, and this is so very important, is no matter how you do these sessions, whether you're doing them via a cell phone or you're doing them via a laptop, you really do need to use a virtual private network so that you are protecting the sanctity of the counseling session, and you are making it as secure as possible. Consumers are providing very important information during these sessions, as we know, and it is our utmost responsibility to make sure that we are protecting all of that data. So I want to talk about 4 systems today: WebEx meeting, Zoom, Click Meeting, and Join Me. And there's also a very good article from PC Magazine that talks about a number of different systems. And I will make sure to provide that link to Ellie so that she can add that to this presentation. So if people would like to check out that article, they can do that. It has information about the systems that I'm going to talk about, as well as some other systems. So WebEx meetings, it allows for face-to-face meetings from anywhere over a number of different devices. There are several different plans, including a free version that has a lot of good features. The free version allows up to 100 participants per meeting and 1 gigabyte of storage. The starter version, which costs $13.50 per month, has 5 gigabytes of cloud storage. So if you're going to be using this to do a recorded presentation, you might want to look at the starter version so that you have more storage capacity. And I think that most organizations that need a subscription can get away with the starter version, which again is $13.50 per month. You can use a dial-in number or an app to access the meeting. It runs on Android, BlackBerry, Apple I operating system, as well as Windows. So if you, for example, are going to be looking to meet with a consumer, you can send them an invitation, and they can put this app on their phone, and then that way they're able to quickly and securely enter the meeting. There is screen sharing available, so if you wanted to share your screen, you have the ability to do that. And then there is a training application that is part of WebEx that can work for group instruction. So it's a very good system that can provide a lot of flexibility for organizations looking to provide this type of service. The next one I'd like to talk about is Join Me. And Join Me is part of the Log Me In family of applications, which also includes GoToMeeting and GoToWebinar. And I'm sure that a number of you have had an opportunity to use some of these systems in the last couple of days. There is a free version of Join Me, and then there are also discounts available for the subscription services for nonprofit organizations. And so that's helpful, of course, for our organizations to be able to have those discounts. The Lite plan is $10 a month, but it allows only 5 participants per meeting. So it works very well for the one-on-one sessions, but might not work as well if you're trying to do a larger class. So you want to keep that in mind as you're looking at the subscription. There are no toll-free numbers that are available with this particular system. So it means that someone that's calling in, is there's going to be a long-distance charge, but that shouldn't impact most organizations or most people that have unlimited plans. Another good feature of Join Me is that you can actually lock the meeting, which means that an attendee must knock in order to request access. That way you can be assured on exactly who is attending any meeting that you schedule. And again, like the other system, these meetings can be accessed via Android or the operating system devices. So that helps when you're working with consumers that are using Android or iPhones. Another system that has become very popular in the last few days is Zoom. As a matter of fact, I had a very interesting opportunity to use Zoom just 2 days ago, in that it was my mother's birthday, and we had I think nearly 30 people on a Zoom call, calling from different parts of the country all at the same time to wish my mother a happy birthday, and it really showed how this new technology is working. So the free plan with Zoom allows up to 100 participants, and you can see each other over the phone or using your video camera, or you can block the camera if you choose to. But you can see people. If you put it in a gallery view, it allows you to see everybody on the phone at the same time. The only thing about the free plan is that the maximum meeting length is 40 minutes. So if you are going to use that for a counseling session, then you know that your session's only going to be about 35 minutes before you have to conclude that. Zoom works with Android as well as Apple operating systems. There is a pro subscription that is $14 a month. Like the Join Me, there's not toll-free numbers, but again, if you are if you have a call plan that's unlimited, then you really don't have to worry about whether it's a toll-free number or if it's a toll number. The meetings are secured with end-to-end encryption, and meetings can also be password protected to prevent uninvited attendees. And something that I want to point out about Zoom, this has been fixed, but again, you want to make sure that whoever you're working with in terms of technology is looking at this. There was a flaw that allowed hackers to potentially spy on Zoom when the user was using a Mac webcam. Both Zoom and Apple have addressed this, but again, you just want to make sure that whoever is providing your technology double checks this so that you don't have any potential issues. And then finally, I want to just highlight Click Meeting, which is another one of these systems. Click offers a 30-day free trial, which allows audio and video meetings for up to 5 people and webinars with up to 25 attendees. Of the systems that I'm showing, Click Meeting is the only one that doesn't have a long-term free plan. It's free for 30 days, and then you would need to sign up for a subscription. Their live tier subscription, which is the lowest tier, is $25 a month, but there is a discount of up to 20% if the plan is paid for on an annual basis. The host through ClickMeeting can invite attendees via email and text message, so it's very easy and convenient to use. You also have the ability with ClickMeeting to live stream events on Facebook or YouTube. So if you wanted to do some type of class for consumers using that system, using YouTube or Facebook, you have the ability to do that. Again, like the other ones, ClickMeeting uses is available for Android and for Apple applications. File storage for ClickMeeting is about 500 megabytes on the free version, and then it moves up to 1 gigabyte for the live tier. So those are just some brief highlights about 4 of the different systems that are out there. I'm sure that many of you have had a chance to use one or maybe all of these over the last couple of weeks. I know that I think that I've used at least 3 of them in the last 2 days alone. We will be putting up more information about systems on our webpage. So again, you can look at housingactionil.org for updated information. And with that, I will turn this back to Ellie. Thank you.
Thanks so much, David. That's really great information. And yes, please send me that link to the PC Magazine article. Our next presenter, okay, great, thank you. Our next presenter is Christy Peel with the Center for New York City Neighborhoods. And Christy is going to spend some time talking with us about how this particular crisis is the same, but also different from a natural disaster response, and the importance of operational consistency and how we'll need to think about how to best address this widespread impact. Christy.
Thank you, Ellie, and thanks everybody for this great conversation. So just a really quick headline about the center. We're located in New York City, which is unfortunately, as of today, the epicenter of the COVID-19 pandemic. And our focus is on affordable homeownership, which is why we're a member of NHRC. We were founded in 2008 in response to the mortgage foreclosure crisis, and our network of housing counseling and legal services providers, which is a statewide, located in New York City and also statewide. We work with the New York State Homeowner Protection Program, and we have a New York State call center, which connects homeowners directly with services. So this infrastructure of housing counseling and legal services providers and our call center also played a critical role in helping homeowners, the renters and the communities impacted by Hurricane Sandy in 2012 recover from that really catastrophic event. And we did that by providing funding to homeowners directly, $2 million in grants directly to homeowners. We raised money for services. As we know right now, that's a really critical need, and we're hoping that philanthropy is going to play a role in providing funding for services while we push for a much more significant federal funding, as Melody mentioned. And also we, as NHRC does, we do a lot of training and technical assistance, convening, and really focused on developing policy responses coming out of the recovery. A lot of the results of that advocacy helped us incorporate housing counseling in the CDBG-DR funded programs in New York City, New York State, and that's the Community Development Block Grant Disaster Recovery Funding. Some of you may go all the way back to the foreclosure crisis and remember that the Neighborhood Stabilization Program was also distributed through HUD under the CDBG-DR program. So getting housing counseling groups familiar with those funds and those programs is a really important part of being part of the disaster response. One of the critical differences that we're facing between responding to Sandy, a natural disaster, and a pandemic is really, the fact that we're all experiencing it, right? This is a all-encompassing problem. It's highly communicable disease. It's potentially lethal to our most vulnerable clients, and there are so many unknowns, right? When we compare it to Sandy, there was a very discrete and very defined area of impact, and only a certain number of our agencies were out of our offices, and it was a limited amount of time. However, we're already, seeing a lot of folks calling our hotline, trying to get a forbearance, telling us they've got loss of income, saying they either lost a job or lost rental income. And while we're already seeing the impact of it, there's a lot about this situation that is incredibly unknown. So we don't know how many people are ultimately going to lose income, how many people are going to be ill, how many people are going to be fatally impacted, who's going to lose income, where we're going to see the cascading economic impacts. There's a lot of unknowns, which is really challenging. But the similarities, as we know, are going to be loss of income, loss of employment, and folks' homes are going to be at risk. So we've been thinking about, how we're better able to respond because of our experience with Sandy, and where we also still have a lot more capacity to build. Right before the mayor and the governor locked down New York City, we prepared to go remote at the center. And what we needed to do, since we run the statewide hotline, was to figure out who was still going to be able to be open and take referrals in a remote environment. So the first thing we did, even before we shut down our offices, was to survey our network. And then we got our hotline ready to take the calls from home. We figured out who was able to do phone counseling. We spent a lot of time considering those PII considerations that were mentioned earlier. And we also had moved twice in the past year, so we were able to do a lot of this stuff fairly easily. We also have a great IT vendor, which I strongly recommend. Our phones are, not only do we use Salesforce, but we also have a phone system called 8x8, which is very adaptive to a virtual environment. One of the positive legacies of Sandy is that we now have a cloud-based server, and we also have a VPN for our loan origination system. I will say that we did not consider what our physical mail issues were going to be. So that's been definitely tricky, and we're working with our building on figuring that out. But given the current restriction on essential businesses, it's definitely a new capacity that we have to figure out going forward. So we sent this survey out on March 12th. We sent it to 91 groups across the state, and we received results from 69. Basically, we were asking in the survey, what's your capacity to work remotely, receive referrals remotely? Do you think your capacity is going to be the same or different? And what tools are you going to be using to do it? So we started getting the results back on Friday the 13th. So the other significant difference between COVID-19 and Sandy is that things are changing so rapidly. So that was 13 days ago. A lot of the information, I'm sure, has changed. We got a 76% completion rate. We found out that 64% of the groups were able to offer services by phone. 10% were offering video counseling. And I included that caveat about the date of the survey because at that point, 17% reported that they were still offering in-person counseling. Again, it's a New York State survey, so it's possible that there are some statewide groups that are still doing in-person counseling. 7 groups also said they were no longer accepting the referrals. We also saw that, no surprise, and this goes back to some of the stuff that Bailey was talking about. A lot of folks anticipated that they were going to have a reduced capacity going forward. And in fact, 49% said they anticipated changes in their capacity. The other thing I wanted to highlight from the survey was that 68% said that they did have a continuity of operations plan in place. So I thought that overall that was a really good number. And overall, it was great to see how many folks were able to easily transition to phone and video counseling. So one of the other major lessons that, or major capacity impacts and legacies that we've continued after responding to Sandy is that we have a really strong relationship now with the local volunteer organizations active in disaster, the VOADs. And if you've ever followed any of the FEMA responses, VOADs are usually activated in conjunction with FEMA and disaster areas. This interagency coordination and communication is so critical because it means that we're constantly communicating about pooled resources in an efficient way. It helps avoid a duplication of services, and that's so critical for the recipients of CDBG-DR funding, because if you get a grant for something and then later you're eligible for federal assistance for that same thing, it triggers something called duplication of benefits. And you could lose out on a federal benefit at a more significant level because you got that initial grant funding. So being super coordinated about who's raising money, who's providing resources up front, so you can track the provision of services on a case level across time, is really only possible when you've got those close relationships with the VOADs. One of the things that we were able to do during Sandy, which is much harder, is that we were able to have face-to-face counseling. Obviously, that's really difficult now, and the social distancing that we need to engage in, it means that we also need to develop new capacities for acquiring documents and homeowner signatures. A lot of our older homeowners really prefer to fill out applications on paper and engage in paper processes. So I think we as an industry really have to think about how to provide more capacity for folks that want to be able to do that. I mentioned earlier some of the systems we have in place. I will add that we use Slack for internal communications, Virtue for encryption, and I mentioned Salesforce. And I think overall we've been really, really pleased. Two other things I'll mention. As an industry, the world is really different now. So when we were trying to negotiate forbearances and modifications post-Sandy, it was really challenging. Fannie and Freddie have come out with much better guidance now, so that's great. I will say one thing that is challenging is that a lot of our banking relationships have changed because the folks that we dealt with at the height of the foreclosure crisis and after Sandy were a lot of the mainline banks, and now we spend a lot more time working with the non-bank servicers. So the fact that we're in a post-HAMP environment is definitely going to be challenging. And I will also say that the influx and the immediate influx of scams in this pandemic environment has been really frustrating, but unfortunately not surprising. And we're really very concerned about senior homeowners in particular. There are a lot of targeting of scams at seniors, and not being able to be face-to-face with folks makes it challenging. There's also been really a hard pivot for the courts and legal protections around foreclosure. So that's another area where we've seen that there's a lot of change needed, and there needs to be real clarity around the legal process of foreclosure and what protections are in place for pro se representing homeowners in particular. So with that, I will hope that you guys can help us solve some of these problems, and I will turn it back to Ellie for the next speaker.
Thanks, Christy. That was really helpful information. Our next presenter is Jackie Boyes, who is with Money Management International. And Jackie is going to talk with us about planning for going forward with some examples about how they have handled these issues. So Jackie, take it away.
Thank you, Ellie. So MMI is a HUD intermediary. We have 26 branch locations and 5 call centers nationwide. So we look at this from a pretty large perspective. So as coronavirus began to accelerate, we took proactive steps and reduced our risk by sending all of our staff home to work. Their health and safety are absolutely our top priority. To best secure our team and to mitigate risk, we suspended all in-person counseling immediately. We suspended all in-person education and all work-related travel. So for today, in the environment we're in today, if you want to travel, it takes executive level approval, and I can tell you right now, nobody's traveling. So employee absenteeism is the most significant threat the virus poses to us today. More than ever, we need our workforce able to work and deliver these important services that consumers are seeking. So we're looking at any and all means of keeping our staff safe, healthy, and yet providing for services. We educated our workforce, as I'm sure everyone has done, on how to stop the spread of the virus. Social distancing, everybody's new buzzword, right? Wash your hands. That's my tagline on every discussion we have today, wash your hands. During the pandemic, MMI's leadership team is meeting regularly. We have at least a weekly meeting now, down from the daily meeting we were having as all of this was evolving. But we're looking at guidance from government, from other agencies, from health departments, and we're looking on both the national level and then at the level where our employees are living and working in their locations. We're making changes as we go along. I think everyone is having to do that. So it's fluid, but we do have a plan that we follow, and the basic concept there still plays out even in this pandemic. We're a very fortunate group in that most of our workforce already did work from home or could work from home. So we were able to stand up that very, very quickly. And I know that that is still a challenge, especially for some of the smaller agencies. And so I hope that you learn some things in this discussion today that you can take with you, and you know where to go look for the resources that you need. We have had no loss of service in the time that it took us to basically evacuate 5 call centers. We had enough staff who already worked from home that we could fill the gap and provide services while we get those other staff moved home. It's quite an undertaking to empty out 5 call centers. And today, 95% of our staff is at home, working, fully equipped, and ready to help the consumers. The other 5% or so who've remained in branch locations are either in a single location where the door literally is locked and we're not allowing any in-person flow, or they're in a very large center where they're geographically dispersed around the center and in the course of a normal day have 0 interaction with someone else who's in the building. So, you know, it kind of sounds like we know what we're doing. But the truth is we didn't get here overnight. We prepared for situations like this. So we have a business continuity and disaster recovery plan that we test on a regular basis. Every time we do a test, we update that plan and work towards 100% ability to avoid any disruption, regardless of what the situation might be. In 2017, we experienced a real-life test with Hurricane Harvey. It impacted our Sugar Land, Texas office that is our headquarters. So our offices and a very large call center were not usable, not available to us. But even worse than that, our data center was in the basement of that building and went underwater. So we had to learn some really tough lessons through Hurricane Harvey. And one of them was the fact that we had a backup redundant system in Phoenix, but it turns out it wasn't 100% replica of our primary system. So while it seemed like it was a tool that we could continue to provide services with, and we did, there were so many little pieces that were not there that left really big gaps in our business continuity plan. So we learned really tough lessons. And so we learned that the right equipment is your best friend in an emergency, and something I think you guys are all hearing on this call today. We also did learn how to stand up a really large workforce at home very quickly, because in those days, we did not have the work at home force that we have today. So we took those lessons learned in 2017. They were really tough lessons. And we really beefed up our business continuity plan. And we began to test that plan annually. A very, very serious, time-consuming test, but we have done it faithfully. So in 2018, we tested our plan, and I thought it was a pretty far-fetched idea at the time, a pandemic, right? I remember thinking at the time, let's hope this really never happens. And so here we are. And while I'm not saying that our plan is perfect today, even from the lessons that we've learned, our plan has certainly put us in a position to be very, very well equipped and ready to move forward with this pandemic response. So today, 95% of our workforce is at home working, like I said. We're able to conduct the business of housing just as we have. Most of the time, our consumers would not know the difference because of some of the things that we have in place. We have a few challenges, the things that folks have already talked about. Documents, printed information, and mail, I think, are always going to continue to be a problem in these situations. And if other folks come out with great ideas about how to resolve some of those things, I think we'll all want to share in those. But additionally, as you move people home, because that looks like where we all have to move toward, you need to think about the security of your data and your client confidentiality. And so there's been a lot of talk today and some great ideas about equipment and networks and the things that you can do and use to make your business continue to flow. But I have a couple of just points I want to make that were things that really stood out for us and part of our lessons learned. So if you're moving from a more of a pencil and paper type scenario to a really robust network or system, you really need a reputable vendor to help step you through all of these pieces of equipment and the software availability and what could work for your business. And so you're going to need to take the time out to find that company, that person, and then talk to them about what is available to you. At MMI, we have a proprietary system. However, we operate a VPN, and we also work in a cloud-based environment. So we're in a situation where we could send people to home to work with equipment that works somewhat better than a laptop and a cell phone. And that's, a laptop and a cell phone are great if that's what you need to move forward to keep business flowing. But over the long haul, if that's where you're going to stay, laptops and cell phones don't really provide the best experience for your employees. So at MMI, we use a device that allows us to tap into our network. It's not a laptop, it's not a desktop computer, but it does allow us to tap into our network, and it allows the employee to have their desktop exactly like they would have had they been sitting in their office. So one of the things we learned, though, is that Wi-Fi can be sensitive, and others have spoke about that. Wi-Fi is where your data security probably has the most vulnerability. And so one of the things at MMI, for those folks who work in the counseling space, we do not allow any counseling activity to happen over Wi-Fi. And so what that means is, yes, you have to have an Ethernet cable plugged in to your modem or wherever your internet enters your home. And so, yes, we've shipped out 100-foot or more Ethernet cables to people so they could literally drag that cable into another room from where their internet comes into their home. But that's what you have to do sometimes to protect your data. We have internet phones that are compatible with our systems so that we don't have to depend on folks to have landlines, because that's basically unheard of anymore. And those things are available to you too. So when you talk to your vendor, remember that you are not necessarily stuck with a cell phone. The other thing that we do not allow in our counseling space is we don't allow printers except in essential areas. So client information isn't printed at home and lying around on someone's desk or placed in their personal trash or mixed up with their children's homework or, any of those things that can happen when you print documents. And I know that sounds crazy that you could actually operate in a system that doesn't allow you to print documents, but it can be done. And so in your brainstorming and in your discussions, you need to think about how do we accomplish what we already accomplished today, but we don't do it with printed documents. One of the things we've done immediately is to switch to an email-only delivery. So even though our system thinks that it's printing a document, it's printing it to go out to email. And so there are, of course, exceptions with some folks out there who don't have email today, but truly there are not many. And most people can receive documentation through email. They can also email us, and we have encrypted email. So an encrypted email is a really, really simple process. And if you don't have encrypted email today, but you need to share your documents with clients through email, you need to talk to your vendor about how you encrypt those. Others have talked about Skype calls and other deliveries, and Skype call is wonderful. Anything where you can have video and present yourself to the consumer is wonderful, but you need to be considering the security of that call. Can you record that call? So if you use some of the platforms that David talked about earlier, yes, you probably can record that call and have it for later on. But with some folks out there just using their own personal devices, you may not be able to record that call. You may not be able to protect the security of that consumer. So my point in all of this is to say that no matter how large or how small your agency is, you need a business continuity and disaster recovery plan. And you need to test that plan on a regular basis. Just like you would have a fire drill in your building, have a drill, test your plan. Test it with varied scenarios because you can see from our experience how that has in fact helped us. You can never really be too prepared. Now that we're living with a pandemic, be sure to take notes of all the shortcomings of your plan if you already have one in place. We've certainly done this over time and no plan has ever been perfect. So as you record those notes, when life gets back to normal, and we hope that's sooner than later, be sure that you debrief with your people, regroup, and update your plan so that you fill in all of those gaps. Thanks for letting me be here today, and you guys be safe out there. Thanks, Ellie.
Thanks, Jackie. Yep, thanks, Jackie. We are now going to move to Milt Sharp with eHome America, and he is going to talk with us about what they have to offer for housing counseling agencies to manage services in this virtual environment. Milt. If you're speaking, Milt, you're on mute. So Milt, we're going to come back to you. You need to enter your PIN number so that you can speak. So we're going to move on to Ken Vigos. Let's go. So Ken is with the Affordable Housing Centers of Pennsylvania. And Ken is going to talk with us about his experience recently using Zoom for their homebuyer education workshop. Ken.
Thank you, Ellie. Can you hear me?
Yep, we can hear you.
Okay, great. So thank you for inviting me and for allowing me to present. Yes, so this was, like we explored different like platforms or different options whereby like this was a workshop we did on March the 14th. And the crazy thing about this, as of March 12th, all indications are all expectations was that this workshop would still take place in person. And as we all know, a lot changed by the hour, and whereby it came to the point where that Friday morning we had to make a difficult and immediate decision to whether to cancel the workshop or try with a different alternative. And so we explored to say, okay, let's do this with Zoom. How we these platforms have been available and for conferences. Let's do it within a workshop format. And so we purchased the Pro membership, which is like that $14.99 membership per month, and announce the workshops to those that have pre-registered. And with that, we had a very good response, I would say. It was like those that attended our workshop was actually very similar to those, like as far as the percentage of those who attended our workshop was very similar to those who attend an in-person. About 50% of our pre-registered got online, about close to 40 people. It was a learning experience for all of us because for all my staff, this is the first time we were utilizing like Zoom just to begin with, and now trying to utilize in a workshop setting, like making sure how we can mute conversations for the participants, like manage questions from the audience, if the lenders or the realtor wanted to provide a presentation, how they can be able to have that on display. So one of the key things that we, as was talked about in today's webinar, is like the constant communication that is necessary, and that's consistent with now having a like a Zoom or virtual workshop. For many of our lender and realtor partners, they have also expressed that this is their first time that they're doing a virtual workshop themselves. So you have to try to like walk them through like how like it's a simple process, and there's not once you get online, there's nothing different compared to when it's done once in person. The key things that we were debating is the fact that how can we control audience participation, and also with various funders that we do utilize, they require that people stay for the entire duration of the workshop, and to create that accountability factor. So, and the consideration of like versus people when they come into our office and they try, like the first thing they do is sign in a sign-in sheet with that we have available. Well, that's not present with like utilizing Zoom or any of the other platforms. So we actually created our own email address that at the conclusion of the workshop that they would email us to say their sign-in and confirmation that they stayed for the duration of the presentation. You know, first providing us with their name, their email address, their phone number. We and ahead of the workshop, we sent out all the materials that we would present at the workshop. So, for example, our home buyer books, stuff talk about fair housing, predatory lending, that was made available to them prior to the actual workshop, to all the, at that time, 80 participants. And once so after the workshop, and once at the conclusion, they sent their email of their confirmation of their signing in. We then followed up with them with an email to then say, here's the DocuSign link to fill out our intake form, which allows us to enter their client information, to our client management system, which provides that so that like knowing the fact that we verified that they were present and they attended the workshop dynamic. Certainly after the first go around of that, we had a very good experience from like as far as our counselor, and I was on the call as well, as far as the good communication. Like everyone was very understanding and accepting with this new role and new dynamic. We actually had a follow-up workshop on the last Tuesday with good response. Challenging thing is like after the when the workshops end and we try to send them the email to like submit to give them the DocuSign intake form, about only 2/3 of them have actually turned them back. So we also have to communicate with those that actually were on the workshop who haven't followed up with their giving us the necessary form back so that we can prepare the client management system to provide servicing to them. So like everything, there's just constant communication, and we learned from the first workshop that we had to set up these individual email account so that we don't have one email that is the actual place where we're delivering all the content, whether it's your DocuSign intake forms to your email sign-in to, that we have to separate them so that we can compartmentalize them so that it can keep ourselves organized. Otherwise, there's a lot of like that main general email box gets jumbled with like various different emails. So, and then it's important just to then for all your new counselors that are doing this like this to spend the extra time with them to get them comfortable with utilizing this the new platform. And to like even test them out, like, all right, we're gonna do a workshop, or we're gonna do a workshop, like we're gonna create a workshop, and like you're gonna be the host, and I'm gonna be the participant. We'll have some of our other counselors on the line as pertaining to their participants, so that you can they can navigate the controls of being the host. So I would say spending that time to do some dry run-throughs for each of the counselors that can definitely be helpful, so that when the time the workshop does take place, they are ready to go.
So is that it, Ken? You set?
Yeah, that's it. So that's...
Okay. All right, great. Thank you. We're going to back up to Milt Sharp now. We resolved our technical issue with the phone line. So Milt, please go ahead and tell us what eHome America has to offer.
All right. Well, I want to test first. Can you hear me?
I can hear you.
Hello? Okay. All right. Good. Thank you. All right. Well, greetings, everyone. And I apologize here, but I do appreciate the opportunity to share with you all how eHome America can help support your continued efforts in helping families secure that safe and sustainable home ownership during this pandemic, and possibly further in the future. Many of you, in response to your need to close your offices, have had to adjust your service delivery model to introduce more telephonic and virtual counseling. Additionally, in response to this need for social distancing, you've had to either minimize or cancel your face-to-face classes, and have started to direct your customers either to eHome America or another online educational platform. eHome America was designed to educate as many first-time homeowners in advance of moving into home ownership. We also wanted to create tools, programs, and services to assist the industry in being more efficient in how they deliver these services, build their capacity to touch more customers, and ultimately generate more revenue towards their sustainability. We believe by utilizing the web as a means to provide access to education 24 hours a day, 7 days a week is very efficient, and that the customer upon course completion has the ability to be able to meet either telephonically or virtually with a counselor. They're also able to get access to the education 24 hours a day, 7 days a week, provided they have an internet connection and either a smartphone, a tablet, or a PC. There are specific features of eHome America that make it really useful in the delivery of homeownership education and follow-up counseling. eHome was designed as a companion tool for counselors to help monitor a customer's progress through the course and their performance on the multiple tests and learning checks and things that are there. This is accomplished through accessing the robust admin panel that's on the backside of eHome. That's designed to inform the counselor on how the customer is performing in the course so that they can then tailor their follow-up one-on-one with the customer after they've completed the education. The worksheets, test scores, time spent in each of the chapters, etc., are all available to the counselor on the back end. And in many ways, we encourage them to use this information to drive what information is covered in their follow-up one-on-one. This is just one of the ways that eHome helps to create efficiency in the delivery of counseling services and get customers what it is that they need in order to be able to move forward in this process. So as many of you adjust your workflows to deliver services virtually, eHome has a few additional features that can help facilitate your counseling activities remotely. One of those features is eDocs, which allows for you to provide your customers with documents and forms that they need to review in advance of meeting with you, possibly sign them or complete them in preparation for their follow-up one-on-one session. eDocs can either be part of the registration for the customer, and we can put this information in front of them, or the counselor can present eDocs to the customer at any time during the process for them to be able to complete these forms. It's utilized by many of our partners, and this feature helps to save time and, again, as I talked earlier, create some efficiencies and convenience for the customer through the counseling process. Aside from eDocs, customers can also upload any documents that the counselor needs into their profile. It's saved in the user's document area of the customer profile. Counselors can also upload documents for a customer, and they can access them from their own login and document areas of the My eHome page. Additionally, to enhance communication between the counselor and their customers, we also offer an online chat feature. Counselors can activate the chat feature at any time when they're working, and so they can show themselves to be available to their customers who may have questions as they're going through the course. A counselor can also deactivate the chat anytime when they're finished or they need to take a break, so that a customer won't see that they're available, so they won't be available for activity or chat. I would also mention, just in terms of the system stability and security, eHome is able to handle the increase in customer utilization just over this last 2 weeks. As you can imagine, we've seen a 30% increase in the utilization of our product. We're built on state-of-the-art technology, and our servers are designed to grow dynamically on demand. So we don't anticipate any disruption in our services. So lastly, as I wrap up here, in addition to eHome America, we have a suite of other online products that you can offer your customers who participate in either your financial capability, foreclosure mitigation counseling services, or post-purchase services. We also offer Impact Pro, our client management system that allows for the smooth transition of a customer from eHome America through to counseling on through to closing. For our network over the next few weeks, we're going to be hosting a series of webinars to share tips and tools that they can use to be effective in a virtual work environment. We're also working on creating additional marketing materials that they can use to promote their services virtually. So If you're not already a partner, then we would encourage you to go out to our website. Please feel free to visit us. We're at www.eHomeAmerica.org. And so in closing, I want to offer the eHome America team continued hopes and wishes for health and wellness for you, your families, and the communities across the country that we serve together. Thank you all, and I'll now turn things back over to the next presenter.
Thanks, Milt. So our next presenter is Kelly Zimmer with the Sioux Empire Housing Partnership. And Kelly is going to tell us a little bit about their experience there with using Skype for one-on-one counseling. Kelly.
Yes, thanks, Ellie, for having me on. So I am the Education Director. I've been for a little over 8 years at Sioux Empire Housing Partnership. We are based out of South Dakota. It was probably about 5 years ago I realized that we do have a lot of clientele that want to take their course prior to relocating to Sioux Falls or locating to Sioux Falls from different jobs in different areas of the country. So we decided to open up the Skype capability to make sure that we could meet the needs of our clients. We recently have had Skype pretty much every day because of this pandemic that's going on, but it makes us happy that we have the ability to work from home because not everybody has that ability at this time. Our office is technically closed to the public and has been for the last week and a half. We are able to go in as employees if we need, but we do have our laptop that we can work remotely as well. So we've seen an increase in people actually still wanting to do it face-to-face or social media versus an online course because then they can get their questions answered. This last weekend we did our first go-to meeting and it went very well, and we're doing another one this Saturday. So I recommend Skype. I recommend it to clients who are maybe coming from different areas and moving to your location. I recommend it for people who are just in different areas in our state. It's a great tool and it's a great way to be able to answer those questions via face-to-face. That's really all I had, Ellie. Just want to kind of give an update on what we do here at the Sioux Empire Housing Partnership.
That's great. That's great. Thank you so much, Kelly. So next, we're going to hear from Andrea Holak with the Housing Partnership, and she's just going to tell us a little bit about the issues that they are facing as a small organization. And Andrea, let me get you unmuted. And there you go.
All right. Hello. I just wanted to talk a little bit about our organization and some of the challenges that we are facing. We are a really small organization and we're located in suburban St. Louis. Our staff is a staff of 4, so we're quite different than some of the organizations that you've heard from today. One of the benefits that we do have in having such a small organization is that we are flexible and able to really roll with the punches on a lot of things that have been happening as everything changes day to day and hour to hour. And our staff is just really dedicated to making sure everything works, really going the extra mile on this, as I'm sure many others are. But I feel really blessed to have a staff that's gone above and beyond to really make things work. Some of the challenges are our technology has been, it's very dated, to be quite honest. As a small agency, we have a limited budget, and our focus has been on client services, so tech updates have not always received the top priority. We've seen lately a shift in funding from operations, so anything that's gone to help tech updates and infrastructure has shifted to more programming, which is nice, but at the same time, you know, slowly those tech updates just get overlooked. So we had actually just ordered new computers at the end of the year, and they were supposed to ship before the end of the year. They got stuck in China as everything shut down there. So we just got them actually the week that we were going to be on work from home. So it's been a bit of a whirlwind to get everyone up and running. Some of the challenges that we face with a rural and elderly population, which is a lot of what we serve, it's not so much rural in the sense that we're out in the country. It's just more of a suburban population, and they often face some tech challenges. That's been our number one barrier, I think, by far, is we have an older population and a population that is a little weary about using technology. So as it was mentioned earlier, there's a lot of scammers that are popping up now to take advantage of people. We see that especially with the older community, in that they're distrustful. They are really reluctant to talk to someone over the phone that they can't see, but they don't have the technology to do a web call. So we're really trying to navigate that barrier and build that trust with those individuals that may not, be used to using a Skype or a Zoom or something like that. We also are working with some community partners to get some resolution on some issues. The way our region is set up is we have a bunch of municipalities and you require inspections from all of these different municipalities rather than one source. So we're trying to navigate all of those different little agencies that need to have something like an occupancy inspection completed to complete a home buyer's down payment assistance, whereas they're doing inspections on vacant houses but not occupied houses. So we're just trying to find ways to work with our municipal agents to find solutions to get the deals that have been in place for quite a while done, so that these homeowners can actually get into their homes. And then, just keep looking for ways to meet people where they are, because that's essentially what we have to do. We're on stay-at-home orders like I know the rest of the country is, and in many situations. So we're trying to get closings done, get counselings done, and just truly meet people where they are. We're doing our group orientation through Zoom, and we're continuing to do our direct calls with clients that are willing to do the face-to-face through Zoom, and we're incorporating more direct touches with clients, such as calls when we can't actually have them in person, for those clients that are just really reluctant to be on a video type connection. So Zoom has been great for us. I would definitely recommend practicing it. We're holding our staff meetings through Zoom just so everyone can get a taste of what it's like to be in charge and run the meetings and set them up, and just really feel comfortable with the material. So that's what it's like for us. We're trying to just be ready for every new adventure every day. So I'll pass it back to Ellie.
Thanks, Andrea. And so our final speaker is Dave Lernan with NeighborWorks of Gray Harbor County. And Dave has some similar challenges that Andrea talked about, but in particular, they really serve a pretty large population of senior citizens. And so he's going to talk a little bit about what they're doing to address that. Dave.
Well, the beauty of being the last panelist is that you learn so much, which changed the shape of my little talk here. But like our continuity plan was actually focused on tsunamis and forest fires instead of pandemics and so forth. So we're going to have to change that plan. But basically, we're a really small organization serving a rural county located on the Pacific coast, about 100 miles west of Seattle. So I think the COVID went over the top of us and went to Seattle first, gratefully. We serve a population of about 72,000 people. Home loans, rehab, a lot of housing counseling, and we also housing counsel statewide. 80% of our counseling sessions are currently serving low-income clients. Now, these are the points of contact. Most of our staff are over 55, and there's only 6 of us. Several have compromised immune systems. Every staff member interacts with our clients in some way or another. So there's a lot of contact involved, especially I think in rural environments. People like to talk directly with people, face to face. I mean, people come in to pay their loans and their rents rather than mailing them, for example. Again, these are points of contact. Most of our current housing counseling clients are indeed low-income seniors and renters, and they're applying for our no-cost ductless heat pump program. This is a giveaway, $4,000 unit giveaway and installed. This is a partnership with our local PUD, which is Public Utility District. This program is important to everybody here because it helps lower the heating and cooling costs, which actually help people not only pay their mortgage or their rent, but it also improves some of their chronic health issues because they're now able to actually afford to turn on the heat, which keeps the mold away from their home. So this is a really important point, I think. To participate in any of our program services, however, clients are required to submit documents from a checklist to develop their HUD file. Currently, they have to mail in or bring in their personal information and proof of income to the counselor for copying and vetting prior to the actual appointments. If the ductless heat program becomes a requested service, our construction specialists must also spend time inside and outside of their home to qualify the current electrical system, heat source, all these types of things. And then there are the heating installers and building inspectors. These are all numerous opportunities to spread the COVID-19 to everybody involved. And so we have essentially at this point shut that part down until we can get it figured out. This is a really big challenge to us. Now we've installed VPN tunnels for everybody that works here, and we have a staggered ability to come in and check out any phone messages that are on our message devices and so forth. We're trying to keep separated, and we definitely work electronically amongst each other. But the problem here that I really want to elucidate is that our elderly clients typically don't have the equipment or the knowledge to like scan and send any of their information. And we all know, we're counselors, that there's a lot of information that needs to be scanned and put into the file. So this is problematic. I was really happy to hear about Milt's eDocs because that's how we do our housing counseling for homebuyer education is through eHome. We've been doing it for many years, but we haven't used the eDocs platform yet. So I'll certainly look into that. But also the other part about the rural, I mean we're rural, is that the internet availability and bandwidth can definitely be a challenge to anybody trying to use the electronic version. So that puts us back to snail mail. So we can figure out some of this stuff. We've put up most of our housing counseling on hold as well. A lot of this has to do with, to be successful in the future is outreaching our clients. So every one of our clients has been called actually by our housing counselor, Julie, to let them know what's going on. Again, they're elderly people. They want to know what's going on. And when they show up at our door, they would be upset. So we've reached out to everybody actually. Loan clients and renters can use our office mail drop or the U.S. Post Office for payments, but we're expecting that there's going to be some issues coming up, and that's what we're going to prepare for next is people that can't pay because they lost their job or they're unable to bring it in. So, I mean, I'm in Washington State. We're on lockdown actually. The other challenge that we're concerned about is our non-subsidized renters may not be able to make their payments at all. Our subsidized renters, however, because we're in close partnership with our PHA, they already told us that they're going to be able to make any necessary changes very quickly for people who have lost their jobs. Then we'll be developing plans for forbearance, rent reductions, and hopefully trying to get the HUD counseling back online. That's pretty much it. I think I told you that we're all working from home and we're so grateful to have an on-staff IT who also is our construction specialist. He's been both for about 23 years. So that's been very successful for us to move this into the next stage. So thank you, everybody. I've really got a lot of good information out of you, and that's all I have for now.
Great, thanks, Dave. So we did receive a few questions from people. They did email me some things to ask during this presentation. One of the questions that came up repeatedly was about the extension, possible extension of the certification deadline. And so I just want to say on this recording that NHRC did submit a letter to HUD asking for an extension of at least 12 months for the deadline due to this issue of trainings being canceled, and also the fact that so many of the testing centers are now closing down. And I will be sending a link along with all the other information for this recording to Criterion, which shows an updated listing. They update it daily, I believe, of all of the test centers that are closed around the world, but you can scroll down and get to North America and then find yours in alphabetical order by state. And you can see that many of their test centers are closed. So we await HUD's response on that, so just to let everybody know. I am in the process of unmuting everybody so that anybody can answer questions as I'm reading them. So please feel free to answer if you have an answer. And I would just ask that if you're not going to speak, that you mute until you mute yourself until you are in a position to answer a question, just so that we limit as much background noise as possible. This one, I will say, I think that this could go actually to Milt, and then other people can chime in if they'd like to, but you know, several people asked about fulfilling the HUD requirement on documentation. And so Milt, if you can talk a little bit about how eHome America and the e-document option that you have is available. And you have currently got yourself muted. I don't have you muted, so go ahead and unmute yourself if you can answer that question.
I can, and I've figured it out. So you can hear me now, correct?
We can hear you.
Yes. Okay, good. So eDocs is a feature, again, as I mentioned, within eHome, and it's tailored specifically to the needs of our partners. You'll provide us with those documents, and we will create them in a digital format that, again, can be offered to the client when they are first possibly registering for the course, or maybe upon course completion and in advance of their follow-up one-on-one. These documents can again be sent and put through eHome America and then are stored within the customer's profile within eHome America and can be accessed from there, so that when the follow-up one-on-one session is held and the counselor is within the admin panel within eHome, they have access to those forms and those documents.
Great. Does anybody else have thoughts about how groups might be able to fulfill the HUD requirement on documentation, given the work at home environment that we're in?
This is Teresa, and one thing you might consider is checking in with your point of contact and see if they will accept a verbal signature versus having to have it signed, you know, like your conflict of interest disclosure. If you've read it to them and you can get a verbal from them, see if they will accept that in the short term while we're having trouble. The other thing would be to send documents out encrypted and then have them sent back that way. But for clients sending it back, that can be problematic.
Anybody else?
So,
hey, Ellie, this is Jackie.
Go ahead, Jackie.
So we have a couple of processes where we do verbal agreements, and so we put a verbal authorization on our file, and that's been acceptable to HUD for many, many years. We also have a couple of programs that previously required documentation, as in signatures of action plans and things like that, and they've made exceptions where we've just sent an email and the client has responded to us via email, and that is taking the place of an actual signature.
And were you going to say something, Bruce?
Move in the mortgage field to take photographs of documents, and there's some programs that can now harvest that information, stuff like that. But I'm wondering if a photograph and then emailing that is enough to get you over the hoop, over the line.
Yeah, I should say that we have also asked several questions of HUD about what their guidance is, and so we anticipate, ultimately a response from them on some of these questions, and this is one of them. So I will, I welcome Milt to answer this question, but I also am interested in, Ken, you mentioned that you use Zoom, and wondering if, Christy, if any of your groups in New York City or around New York State that you know of are using platforms to do homebuyer classes. So the person asked the question, they're using eHome and Framework, but they're looking at other distant learning tools, and what are some of the things that work and are acceptable, again, under HUD guidelines and industry standards. So Christy, I'll go to you first.
I have heard that folks are really taking their existing PowerPoints and putting them either on GoToMeeting like you all have here, or using Zoom, or alternatively Google Hangouts. I don't know if those are approved by HUD though.
Okay, all right. Teresa, do you have thoughts about it, and have you heard anything?
I sometimes we get direction from HUD, and then we find out the point of contacts are different. I haven't heard anything specifically on that from HUD. I haven't asked them that particular question. But certainly, if you want to send me the question, I'd be happy to see what I can find out from HUD and give you feedback.
Okay. All right.
Ellie,
So
can I add a comment? This
yes,
is David
please,
Young.
David. You were actually the next person I was going to go to.
Okay, regarding the technology and HUD, one of the reasons why I think that there has not been specific guidance over which systems for teleconferencing or for video conferencing are acceptable or not is because all of these systems are for profit, and so HUD is not in a position as an agency to recommend one over the other. I think what the Office of Housing Counseling would like would be actually to get some feedback from the industry as to which systems the industry feels works well, and then the Office of Housing Counseling can include that in their guidance plan.
Hi, this is Milt. If I could add something as well. One of the things that we've encountered in our conversations with HUD is that, they were clear with us that they were not going to dub any education or anything, that they were more concerned with the counselors in the organizations, and that whichever educational tools or platforms they chose to deliver their services were up to them, but they were more concerned with the certification of the organization and the counselors, and not necessarily the tools or the educational tools that are utilized.
Good to know. So, another topic that has come up, and I'm open to hear what you all have to say, but many of the groups are asking about how, what is acceptable to HUD as far as not being able to do the face-to-face counseling, the one-on-one in-person counseling. And what I have been hearing is that HUD, if you look at the HUD handbook, of course, it says that virtual counseling is acceptable as long as it's acceptable also to the person that you're doing it with. But there is that question of, the handbook does say that in-person counseling has to be available. And so, I don't know, Jackie, I'm going to go to you because you all do so much phone counseling. And so I'm just wondering your thoughts about that in-person option being required as something that HUD-approved agencies have as available.
So, yes, your reference to the HUD handbook I agree with. I don't think it's a requirement. In that HUD has long said that all of these forms of counseling can be available to you and available to the consumer. Most of us, however, are dictated by what we have in our HUD work plan. But, honestly, you have to protect the consumer and you have to protect your employee in this pandemic. And so in-person counseling just truly isn't an option. So if you haven't reached out to your point of contact to say, hey, we have to use other means, and do you want my HUD work plan updated or not, you really should do that at this point. And I think that agencies have to continue to deliver these services. I mean, folks are beating down the door to continue to get counseling, and so we can't just abandon what we do because we can't do it in person. And I think that HUD, everybody that we have reached out to in all of our partnerships, including HUD and others, have been 100% supportive of us doing whatever we need to do to deliver those services.
And
Great,
beyond
that's
HUD,
really helpful. Go ahead.
yeah, beyond HUD, I would say also you want to get in touch with like their state housing finance agency as well as the local government that, say, for example, in our case in Philadelphia, we get CDBG funds. And in the contract we have, they specifically say that they only fund face-to-face counseling. So even for them, they had to make a shift to say in that day, like the day before, like March 13th, it was like, to then say remote counseling is permitted for to be built under like this particular plan. So it's like, no, it's just HUD, but just who your main funding sources are.
Yeah, good point. Good point.
Kelly, this is Teresa. Could I add something in as well?
Sure.
It used to be that you had to do one-on-one counseling, and then the foreclosure crisis happened, and HUD came out with kind of an update to that, saying you should do counseling in the means that best meets the client's needs. So that's when they started really allowing the phone counseling. And so now, if everybody's shut down, then certainly, sorry, getting feedback here, it's to the client's probably their best interest if they can't come in. If you could do it by phone, then you're best meeting their interest, so it would be fine with HUD. And on the short term, you wouldn't need to update your plan, but if you decide to continue, then you would need to update your work plan.
Great. Bruce, is there anything else that you want to ask and have our panelists talk about?
So I'm fine. A couple things I want to mention just that have come up that we want to pay attention to. So one is people have mentioned the scams, and we really need to elevate these and think of these both in policy and maybe doing some work in the media. So Ellie circulated a survey, which is we're collecting stories as well of what the consumer experience is and the counselors that are working with them. But we also want to capture these scams. So please use that survey, and maybe you can include that, Ellie, when you put it out. Another area that we've touched on that we want to pay some attention to. So we will definitely do more work in our next session on the tools around forbearance and foreclosure, mitigation and modification. But we're also very interested. We know that lots of you have people in the pipeline who are trying to close on mortgages and trying to figure out what we need to do to be able to make that happen. Some courthouses or recorders of deeds are closed, so you can't file the deed, and in some states you can't disperse funds without having the deed filed. The requirement in some areas to have notary be done in person, those kinds of things. We're working with other institutions, but if somebody's an expert on this, we're interested in it. We'll probably spend some time doing a session on that as well. We want to be useful, so let us know what other things you need to know about that we can be figuring out how to get area experts in and get them involved. But I think from my point on, this is a good discussion, and thanks so much everybody for moving forward on it.
Yeah, thanks everybody. This has been really great. And so now, Bruce, all yours.
So quick update on, actually, I'm going to put out one thing quickly on Savvy. So Savvy has gone free for, so people who are having problems can get their phones reworked through their process. Savvy, of course, is the online tool that we have.
Bruce, you cut out there for a second, and I think you were saying that you were talking about the free aspect of the service, and you cut out.
Okay. So Savvy is the online student loan servicing program that can apply to any loan servicer, and we have a partnership with them. There's a fee schedule for it. It's free to use the basic piece, but also for them to file documents that has a cost structure to it. There's a discount if you're a member of NHRC, but they're offering the whole thing for free through July 1 to help people get through this crisis. So I don't think we've posted on that, and I'll post that soon. But that's a helpful tool for everybody that you should know about. So just a reminder about joining NHRC or renewing. We still have the credit report discount, and when things go back to normal, we'll have the Savvy discount as well. But the main thing is you're supporting these kind of webinars, you're supporting the work that we do in the field and the work we do in Congress to try to improve the funding situation. And we appreciate the whole support we've gotten. So next, we're going to have our next call will be in a week, or actually, excuse me, I don't know when you're listening to this, but it'll be April 2nd. We're going to have Fannie Mae, we're going to have Freddie Mac, we're going to have FHA. We'll be talking about the tools around forbearance, what's new, and what tools you can use from the existing toolbox, and also the kind of tools that people need to have on the tail end once they come out of forbearance. We have been arguing in different forums that the solution should be, if it's forbearance, that the individual payments that you haven't paid would be put on the back end of your loan without any penalty, without any increases in cost, in interest rate, or anything. So it really looks like just one more payment or two or three more payments on your monthly payment. We think that that's the least impactful on homeowners. And obviously, if somebody's had a long-term loss of income, it's a different story, and we want to use the loss med tools that are available. But if everything comes back to normal and people have their same income level, trying to make this as invisible as possible for the homeowner is really the best advantage. So our next call will actually start at 1:15. We're trying to stagger it load so we don't have the problem we had a couple of weeks ago. Be aware of that. And we'll plan on it being for more than an hour. Bring your questions and your thoughts, and certainly put them in the question box as we go along. We will have plenty of time for Q&A on this, and we think that and we'll also, actually, I didn't mention we're going to have a National Consumer Law Center Representative Stephen Sharp, who's done a lot of work in this field and is kind of an expert. He'll also be able to give us his perspective on this, and also I think probably add some detail to what the presentations are about the tools you need to know it and how it impacts different populations. So with that quick note, thanks everybody for putting this together, and we will, and let us know what you thought of having a pre-recorded one versus the regular live ones. We'll go back to our semi-regular schedule on Thursday coming up. Thanks a lot, everybody.